Hi there, I'm Jen from Pose, and today I'm here to talk to you about your psoas muscle. Two of them. You have two psoas muscles, and I'm not talking about the iliopsoas. There's no iliopsoas muscle. I'm actually talking about psoas major, and you have one on the right and one on the left, and I'm here to talk to you about some of the ways your psoas muscle might be influencing your posture. So there's nothing inherently wrong about any particular posture or any particular way that we might hold ourselves. However, if we're holding ourselves in certain positions all the time, it might give us more information about how we're moving. And in the case of the psoas muscles, there's many reasons why they might be being held in a more chronically shortened position. And that shortened position can sometimes limit our options for ranges of motion through the hips and the pelvis. And what we want for strong, stable, mobile hips is we want them to be able to move through all their different ranges of motion and have strength in those ranges of motion. But if we've got kind of a tight or weak or chronically shortened psoas muscles, they might actually be interfering with our ability to control ranges of motion in the hip. So here's just a few examples of how your psoas muscle might be reflected in your posture. It doesn't mean that you for sure don't have access to ranges of motion, but these are some typical postures that have to do with a psoas that's chronically short. So I'm just going to move the camera down first. So one of the first things to look at is to take a plumb line, and you want to I'm going to move the camera angle a little bit more. And you want to take your plumb line. I've just got a yoga belt here with the heavy end down, the buckle end down. And you want to place that in the middle of your thigh, sort of in the middle of your pelvis. And you want to see where that lands. Where we want it to land is actually, I'm going to pull my pants up. Where we want it to land is at the outer ankle. But for many people, it lands way out in front, which means that the pelvis is actually shifted. We're actually standing with our pelvis, and now I can feel my toes gripping here. We're standing with the pelvis way out in front. This is one of the ways in which the psoas can influence just our regular posture. So in this, I've got my little pelvis model. So in this version, it's the pelvis. It's not tilted necessarily, but it's shifted out in front relative to the feet. It's shifted forward. It's not back over the ankle. So that's one. If you tend to stand with your pelvis out in front. A second way is that sometimes there's some of us that have kind of a pattern of just always having the knees a little bit bent. The legs are never straight, but the knees are kind of always bent. That's another indication that the psoas is in a tight position. Another way is if the pelvis is tucked. So now we're talking about kind of the rotation of the pelvis over the femur bones. And if the pelvis is tucked under all the time, which also might go along with the knee bend, and then we don't have a bum. There's nothing back here. There's just kind of a flat bum. And the final way is what I call rib thrust. And I've talked about this in one of my other videos, but just quickly here. Rib thrust is, sometimes we have sway back. We're told that the pelvis is anterior, causing kind of this sway back. But more often what I see is it's not the pelvis position, it's the rib position. The ribs are way out in front. So if I just change the camera a little bit here. So if I take my bum to the wall, I take that plumb line like I showed you in the first one, and I make sure that my legs are vertical. You can't see my feet right now, but I make sure my pelvis is not way out in front. My heels are far enough away from the wall that I have space for my bum. I can get a plumb line. I make sure that my pelvis is not tucked under, so these points at the front of my pelvis and the pubic bone are kind of in a vertical plane here. And then I just come back to the wall. If my ribs are now kind of away from the wall, that's a rib thrust. So my ribs are constantly here. If I want to bring my ribs back, that usually shows that I've got a little bit of hyperkyphosis in my upper spine. But if the ribs are way out in front, this is common in yoga when we do this, or gymnasts when we do this kind of thing where we've got the ribs way out in front. But if you're constantly standing with your ribs way out in front, where this part of your chest is not up and down, but out at an angle, not like this. And that's another sign, because the psoas muscles actually attach not just to the leg bone, but they actually come through the pelvis. They don't attach to it. And then they attach all the way up your spine to just below the ribs. So if the ribs are shearing forward, that's another good sign that you've got a shortened, kind of chronically weak psoas. Okay, that's it.